Welcome to Practical Rheumatology for Primary Care, part of the Rheumatology training video series. Today we're going to look at a diagnostic approach to immunologic disease. Let's go.
All right, we're moving.
So we've talked about a general approach to differential diagnosis that's used for all organ systems, the first and worst, finding out what's broke, finding how many organ systems are involved, and going through and clarifying that diagnosis. I'd like to now switch and focus on immunologic differential diagnosis. We'll certainly draw on those principles of general differential diagnosis, but I'd like to show you a few ways that I like to work through thinking through immunologic dysfunction or overfunction in the body. So let's start in with immunologic differential diagnosis. When I'm examining a patient who has a constellation of symptoms, and the question is there a problem with their immune system? The first thing I like to ask is there evidence for immune system activation of any kind? Is the immune system turned on? So things like fevers or elevated sed rate or joint pain, or really there's a lot of things that could tell you this, but whatever it is, you first want to look at the constellation of symptoms and say, does that give me evidence that the immune system is activated? Now, really the immune system is supposed to be running at idle, not off. That's AIDS, cancer, chemotherapy, immunodeficiency syndromes. It's supposed to be running a little bit all the time. Then you get an infection, it turns on, and that's where you get your symptoms of immune system activation. And then if it's an infection, then once the infection is gone, then it should come back to normal or to idle, not off again. Some people have things that keep it on, and we have to decide, first of all, is there evidence that it is activated, that it's still on, and now we need to work this through. So we're saying that yes, it's activated, either mild, moderate, or severely activated, but it is activated. Then the next question is it activated normally? Just because the immune system is activated doesn't mean you have a disease state. It means that there's something driving the immune system to accelerate and turn on. So the next question we have is the activation normal or abnormal? Now we'll go into more detail of normal and abnormal a little bit later, but let's just clarify right now that the immune system's turned on normally, either through infection or maybe something else outside the body like a medication or a drug reaction. Sometimes it's something internal, like a malignancy, where the immune system is normal, but there's something inside the body that's abnormal. Or it may be one of the rheumatologic diseases where clearly the immune system is activated just because it's broken, because it's abnormal. So the next question is, do you have evidence that there's normal activation of the immune system? Is there clear evidence that this could be triggered by an infection, by a medication that the patient is taking, or by an occult malignancy? So you have to clarify those because those are all removable antigens, and you don't want to use immune suppression as your primary treatment when you have a better option of removing the antigen that's triggering the immune system activation. The next thing you want to decide is if you feel that it is an abnormal immune system, it's being activated, it's abnormal, then you want to know what kind of activation it is. So an abnormal activation is usually inflammation. That's what we usually think of, and that's the most common. It's the one I have the most tools to treat. But it can be other ways the immune system is activated. Things like infiltration of the glands, like you see in Sjogren's syndrome. That's not really inflammatory, but it does cause dysfunction of the glands. Or maybe vasculopathy, like you see in Raynaud's, or some types of pulmonary hypertension. And also it may be fibrosis, where the immune system is causing fibrosis in the skin, like in scleroderma, or in the lungs, like in pulmonary fibrosis. And so evidence of immune activation, normal, or clearly abnormal. What type is it? Is it inflammatory or something different? And then we want to go back to where we were at before and pick up, like we do in all differential diagnoses, is how many organ systems are involved with this abnormal, perhaps inflammatory type problem. And so even though you may not have a clear diagnosis at this point of what it is, maybe it won't fit a good pattern recognition diagnosis, you can at least define it by its pathophysiology, that there is immune activation that seems to be normal. We can't find a normal activation, that it seems to be inflammatory, and it seems to be involving the lungs and the skin and the joints. And so there you have a good idea of what's going on. Now you can go into trying to define what is the pattern, what's the best treatment after that. But that's the starting point, and we'll go into clarification of each of these in a little bit more detail as we go on. But this is your general approach to immunologic differential diagnosis.